Our designers in the university were able to work very, very closely with the clinical staff here in the hospital to really get a very deep insight as to the crucial needs that they have immediately at the front line.
We've designed a number of PPE type equipment which are in short supply. So the first was visors. The second project is an intubation hood. But the products are going to be used directly on the front line. The visors will be in large quantities, so will be freely available, both locally and potentially nationally.
We started on the 29th of March with the initial early prototypes laser cut, and we moved on into 3D printing to validate the moulded design. It's a project that would normally take 4 to 6 months to realise from initial concept all the way through to finished product landing, but this has been turned around in 12 days approximately. We have 100,000 of those units manufactured in the hospital. In the same time, we have 24 intubation boxes manufactured to protect anaesthetists during intubation procedures, and we've 10,000 adapters manufactured for retrofitting respiratory equipment to be used during the COVID crisis. We worked on the design on the basis that it's something that needed to be implemented quickly and something that needed to be comfortable. We're going to have healthcare staff wearing these for 12 hours a day or more, had good usability and good comfort, and that we could either clean or replace the visors on a daily basis.
The unique collaboration between the Rapid Innovation Unit and the clinicians here in the hospital gives us a really unique department that is able to respond and make these products as they are required. And I think that's hugely reassuring for the hospital staff going forwards, that they know there are going to be always a potential solution available to solve problems like this when they arise. And that, I think, will be a great benefit to everybody and give us all great confidence going forward.